Talked about the neutrality of posture. There are some muscles in the body that will fight against you as you're trying to achieve that neutrality. So here you have pec minor. Pec minor is this muscle that attaches to the front of the shoulder blade right here, and then grabs the third, fourth, and fifth ribs. And that it's a relatively small muscle, but really, really strong, and it gets really tight. And so that will actually pull the shoulder blade forward and affect this tension here. Another set of muscles that are problematic are the scalene muscles. So the trapezius is here. You have these three muscles that come down and attach and grab out of the first few ribs, and then come up and attach to the back of the cervical spine. When you're breathing with your neck and shoulders, those muscles fire. So breathe up, Jolie. You can see how that pulls up and then contracts down. And when those muscles are firing, they're going to pull tension into your neck and pull your head forward. The levator scapula. So turn around, Joe. So the scapula is here. At the top corner, there's this muscle right at the top corner called levator scapula. It does exactly what it says. It lifts the scapula. And when it's tight, it'll pull this up and rotate the shoulder blade forward and cause tension up here. Another one is latissimus dorsi. So latissimus is this big giant muscle. Basically, it comes from here and goes all the way down on both sides. This giant muscle. It's the muscle that pulls down. The tendon of this goes up underneath, come around, Joe, and grabs the front of the shoulder here and pulls this way, right? So when that big giant muscle is overly engaged, it's gonna pull this down. Another problem muscle is subscapularis. So the rotator cuff has 4 muscles, has 3 on the back that externally rotate the shoulder, and then it has 1 that's underneath the shoulder blade, subscapularis, that wraps up and underneath and grabs this and pulls the shoulder forward. So when subscapularis is tight, it pulls this tight. The upper trapezius, we talked about that earlier. The upper trapezius is one that is, people, when you get a neck massage, like, just dig in there, right? Because that's one that's just really, it's one that's just tight on everybody a little bit because it's a stress muscle. But when it gets tight, it's gonna pull everything up and forward as well. And then the SCM, the sternocleidomastoid muscle, is this, turn your head that way. So this muscle right here, when it gets tight and over-engaged, it'll pull everything forward as well. So these muscles, okay, relax. These muscles, we want to work to loosen them. There are techniques that you can use to loosen these muscles. Myofascial release, so putting pressure on them. You can, a practitioner can do it by manual therapy, just putting direct pressure on the muscles and getting that fascia to release so the muscle can let go. You can use foam rollers. I'm a huge fan of foam rollers. I suggest every one of my patients, every kid athlete, every weekend warrior athlete should have a foam roller. Yeah, Jolie knows. She's been hearing me talk about foam rollers for a long time. So, foam rolling to get those muscles to loosen up. But if you know which ones you're targeting, it's a little bit more effective and easier to achieve.